Plaque psoriasis, guys, well demarcated erythematous plaques. This is a chronic inflammatory disease. You guys are going to see this in your clinic's office often. You need to know what it is, and you need to know how to treat it. This is caused from environmental and genetic reasons, but the exact reason is not known, unfortunately. But they think that environmental and genetic reasons trigger the immune system to have an autoimmune response where you have an over-regulation, over-production of T cells, and these T cells lead you to have an increased production of keratin cells. Remember, we talked about it in the last video. Keratin is a protein that makes up your skin. So this overproduction of keratin leads to overproduction of skin, and you get this red raised patches, as you can see, that are dry, they're itchy, scaly, burning, and they can be painful. So when you get these patients, you want to get a good history. Okay, what are some of the triggers that can cause this? Ask if there's a family history of this. 1/3 of the population has a family history of psoriasis. What can cause this? Stress, smoking, viral illnesses such as strep, alcohol, vitamin D deficiency. Half the country is vitamin D deficient. Use of beta blockers, obesity. Half the country is obese. So you need to talk to these people, ask them, get a good history. Try to figure out what's triggering these actions. Also, you'll find that a lot of these people that come in have a history of coronary artery disease, diabetes, and hypertension. Diagnosis, family history, physical exam. History of psoriasis, most likely these people will have that. The age group that you're going to get this in is between 15 and 30 years old. So if you have an adult, they probably have had this experience before. One other thing you could do is just try to scrape some of those scalings off, and if you see bleeding, that's called an Auspitz sign. That's another way you can describe that in your notes. Treatment with topical steroids, high potency topical corticosteroids such as dexamethasone or fluocinolone cream. You can use medium potency topical steroids such as triamcinolone ointment or cream, prednisolone mid-row dose pack. Other systemic therapies such as methotrexate or cyclosporine. I would not give that in the office or clinic. I would refer them to dermatology, because those medications can have systemic effects on you, affect the patient's liver, and they need monitoring. They need blood work every 6 weeks to 6 months. So I would definitely refer them to dermatology. Alright guys, leave a comment in the discussion. Let me know what you think. Let me know what you go for, what you like to use. I like to go with triamcinolone ointment. That always works for me. I usually get good results when I call the patients back. They tell me they've had improvements. I did have one patient once that had this all over the entire body, from head to toe. I'm not lying. The entire body had a history of plaque psoriasis since they were like 5 years old, they said. And they had Auspitz sign, they had scaling, they had pain. So you always worry about infection at that point. I actually had to transfer that patient. I had to start them on some antibiotics, got some blood work started on them. But this can be a serious problem. Now, I know you guys have heard of the keto diet, and they say that starting the keto diet kind of reduces these inflammatory markers, and therefore people have vast improvements in symptoms. Actually, you guys should go on YouTube and look at the video Young, Sick and Nearly Dead, from an Australian guy. He went on an all vegan diet. for like 6 months, and all his inflammatory markers reduced, and he had normal plaque psoriasis. So which one do you go for? Do you go for keto or do you go for vegan? But hey, both ways, diet was the key. If I was you, if it was me, I would go for carnivore, all meat. You will see a vast improvement. Look it up, guys. Look up carnivore diet. You'll see how people have had vast improvements from their psoriasis, and some of them have completely gone away. But that's neither here nor there. Leave a comment in the discussion. That might be an interesting topic. If one of you guys have psoriasis and you've tried a different diet and it's worked for you, let us know. I mean, we're all trying to educate each other here. Nobody's wrong. Some people are right. It's a boy, Be Rich. I'm out.